Shifting to hips, how do you approach hip dysplasia and when is surgery indicated?
We could be here a while on that. So approach to hips is variant depending on the severity of the disease and the patient and the timing with which we see those issues. So there are cases which we see them really early. There are some techniques that we can use. Juvenile pubic symphysis, for example, in puppies before the age of 16, 20 weeks. If we're seeing them before then, that's potentially an option that can improve the hip coverage. I've moved away from offering things like double or triple pelvic osteotomies, partly because we get such good results with total hip replacement, and that total hip replacement can be done fairly early, depending on the case. If we certainly got closure of some of the greater trochanter osteophyses, then we can operate as early as 7 months of age in some cases. Again, it's slightly case dependent, typically at least 10 months of age, but even as early as 6 or 7 months of age has been reported and we can certainly consider doing. And some cases benefit from that early intervention. So you've got a hip with a really luxoid appearance where the hip is out of the socket, that can really benefit from early intervention with total hip replacement, and doing surgery earlier reduces your risk of complications to a certain degree. In general, though, we tend to see two times where we see hips cause problems in a dog's life. A lot of dogs that we see, let's say at that 6, 7 months of age, if they're not horrendously affected, with appropriate conservative management, a lot of them can do really well. And as they get into skeletal maturity, around about 12 to 14 months of age, some of those clinical signs can completely disappear. That initial pain that we see can be due to just stretching the joint capsule or micro-remodeling around the acetabulum. And as that sort of settles down with scar tissue, some of those dogs can go back to being almost clinically silent. And then we see this sort of second peak of cases around about 5 to 7 years of age, where we're now starting to see the effects of osteoarthritis come in and that progressive stiffness. And in those cases, typically I talk to owners and say we've got two options of treating this. We either continue with non-surgical management options or we look at surgical management. And if conservative management options aren't working for that patient and owner combo, then the surgical options are pretty good. But what works for one doesn't necessarily have to work for all. So the difference, a lot of the conversations that I'll have with owners when they come in is about what their expectations are. And the expectations for a dog that does a huge amount of exercise, and people want to do a large degree of exercise with their dogs, and really that functional outcome is really important. For those dogs, they may feel that the benefit of doing surgery, the risks of doing total hip replacement outweigh the risks, and that functional outcome is really important. But we'll also have patients that they don't really do a huge amount of exercise, and that's okay. Maybe they only need to walk around the block once or twice. In those cases might benefit more, therefore, than having just some sort of conservative management. So it really depends on that owner and pet combo and what they want. The other thing that takes a role within that is people's approach to risk. And that's not the same for everybody either. I'll meet people that probably a bit more like myself, a bit more risk aware and happy to go, okay, well, I'm going to accept the risks of doing a big surgery because of this gain, and I'm fine with that. But you'll also meet people that say, look, I am petrified of doing surgery. I don't want him even to have an anesthetic. Maybe that's not the right thing for them to do. Or they're worried about the post-op care and that kind of thing. So it's a very individual situation. And that is one of the reasons sometimes to say you've got a dog that has hip dysplasia or hip arthritis, depending on where they are within that journey, is to send them to us. Because we can sit down with them and we have those chats. And they're quite long chats. They're quite invasive discussions about what it is that we're trying to achieve, what it is that you want, how we can help, how surgery can fit in with that, and try and make that decision together to guide the owners to the decision that makes the best sense for them and their pet in that moment. So I don't make the decision of we should do a total hip replacement just from the x-rays. It's like there's a little bit more nuance to it to work out actually, is this the right thing for this pet